Namaste, this is Dr. Sunil Richardson. And in this short video, I'm going to tell you everything about obstructive sleep apnea. So obviously you understand this has got to do something with sleeping or sleep condition. All right, I've got a nice presentation for you here. I'm going to quickly go through this so that it's going to be as comprehensive and as simple as possible on this complicated subject of obstructive sleep apnea. Before I start, let me tell you something very quick. 2.5 decades ago, this was not as advanced as what it is today. So many of the procedures that we're doing today were not even thought of giving cures for patients who have major issues in living a day-to-day life and they have this problem, obstructive sleep apnea. So let's come in and dive into this subject. And as I say, we've said it's a life-changing journey, even though everything we do is on the patient's face. So what are the real disturbing symptoms that we've enlisted a few? So there are many issues, mainly with restless nights, daytime awakeness, or the fact that the sharpness in the daytime is less. And also to sleep continuously is difficult. A lot of these patients also have snoring. We're going to talk about also this one particular patient who had this difficult obstructive sleep apnea. He had visited a few ENT surgeons and chest physicians. They had suggested him to wear a different machine, which he was already using. So in the treatment, as a big umbrella, you have conservative treatment and, of course, surgical management as a last modality. Surgery is, in these kind of patients, if properly done, curative, meaning it gives a permanent solution for life. So what is a diagnostic obstructive sleep apnea? Meaning, how do you exactly diagnose this? So X-rays are needed, scans are needed, and sometimes we also need polysomnography. We need to do something called as DISE, and we also have to do what is called as an MRI dynamic sleep study. So let us understand the obstructive sleep apnea. I've got something called as a layman's guide, wherein we've tried to explain what it is. It's a temporary pause in breathing that happens repeatedly throughout the night. That's what it is, temporary pause in breathing. And this blocking of airflow causes this OSA. And there are different issues happening here. Obstruction of the upper airway, especially the muscles on the back of the jaw and the throat. They are very loose. And it's like a traffic jam in a narrow road where there's a issue happening at one point. And because of that, there's a long traffic jam. So because of a small area, usually in your breathing apparatus, this is what happens. And also we mentioned about snoring. Snoring is also there for a lot of these patients. All right, I'm going to go to the next thing, which is about a normal airway and obstructive airway. See very clearly here. I think you can zoom on this so you can see here. Normal airway, the air goes behind the nose. And if I've got this for you, it's something like going from the nose and like this, where my two fingers are meeting. The air doesn't go back and it doesn't get in, so it comes back up. You can see that? And so there are multiple reasons for this, most oftenly issues with the upper airway, the upper part of the airway. So, as I already mentioned, they have daytime sleepiness. They're not able to focus on their work a lot. They're not able to get a sound sleep. They're having disturbed sleep. Many of them, as I already mentioned, have snoring. So all of these things have a great effect on daily life. What is now polysomnography? It sounds like a difficult word, but basically it's just a study that is done to find out how deep or how good your sleep was. It's pretty easily done investigation. I'm sure most Indian cities across will have this, and you have to get it done with some leads placed on your body. And these will give us a report, and that forms the foundation for us also to be able to diagnose these kind of sleep study disorders. So what about CPAP? This is a machine which I already mentioned. Some patients are advised by ENTs or chest physicians. If it's very mild, it does work, but in the long run, for a lot of these patients, it doesn't work well. More importantly than that, a more important reason is the compliance. Wherever you want to sleep, you want to carry a machine with you that's supplying oxygen, extra oxygen. That is what it is, CPAP, continuous positive airway pressure machine. I'm going to show you the machine now. This is the CPAP therapy in the machine. This is what it does. This is how the unit looks. So this is what the patients have to wear and sleep. Now you see, this is not something that's easy to do. You have to strap on a mask and you have to have the appliance next to you. And if you're traveling, then it's a problem. So this gentleman whose picture you're going to see, he lives in the United States and he has already had many of these earlier treatments done. He had temporary reliefs, but not real permanent relief. And he was looking for that and he came over to us. We did all the investigations and I'm going to go through all the different procedures in a while. I'm going to show that to you. But in a couple of weeks, this is the patient's own words. He said he's having a new life. He's having a new lease on breathing. Every night his sleep is continuous, doesn't have breathing issues, and also is having much more attention in the morning. All right, so I'm going to show you his scan now. These are all our patient views, our patient scans. Cone beam CT scan. I don't know if you remember the earlier slide where I showed you this is the normal airway. Here, he came to us like this and we're making it normal. This is the upper jaw and this is the soft tissue, the uvulo-pharyngeal area and the pharyngeal wall, and this is the tongue. So you can see the huge improvement in the airway. So here, in the earlier one, we demonstrated how a patient with OSA has. Here, you can see that on the cone beam CT scan, and this is 3 months after we've corrected. All right, what was exactly done for him in order to get that kind of a change? There you go, before and after. Work on the upper jaw. We did a counterclockwise extensive movement on the upper jaw. And you can see on the lower jaw, 18 millimeters augmentation on the on the sagittal area of the mandible, and another 20 millimeters on the chin. So very major movements. Why was it required? Because his condition was severe. So this is the kind of an after, huge advancements, counterclockwise movements, huge maxillomandibular procedures. So these are called as MMA, maxillomandibular advancement, or we also call them BIJA for OSA or obstructive sleep apnea. And in these movements are determined by the patient's diagnostic values, by his clinical complaints, and also by the soft tissue drape that we see on clinical examination. So I did mention about polysomnography. There's also a MRI dynamic sleep study and a drug-induced DICE. So that's the one that our ENT does, with which we're able to get the endoscopic details when the patient is having a sleep during a drug. All right, so this is before and after. So I'm going to show you this, not for anything, but because you can see that he doesn't look much different in spite of the major movements that we've achieved in his facial-maxillary skeleton. You can look carefully, there's fullness on the upper lip. Jawline has become a little bit more defined, but over and above all, he doesn't look so different in spite of the huge movements that we've done. So that is also something you have to take note here, that this is not done for aesthetic purpose. This is done for a functional reason to cure his problem of obstructive sleep apnea. Now that's his side view. Again, you can see here, the region around the neck, all of this has become tightened, and you can see the length has been increased. The entire face has come forward. This area has become also taut. So the essence of this surgery is to primarily move the soft tissues behind, like I told you, to bring everything forwards and downwards so that we have a clearer airway that will make the patient breathe well. All right, so another view, what I'm trying to say is, if you are a patient or a person who has a lot of snoring, if you have issues with concentrating on your work in the mornings, afternoons, when you should be, you're having problems with sleeping, you think you're moving around, people are complaining that you're a loud snorer, then you should get some evaluation done. You might have this condition, you may not have it, but if you get the investigations done, we can solve these. I have to tell you some scientific information. Some of the studies have also shown that life expectancy comes down for patients who have OSA. They tend to develop hypertension earlier on in life. So it's a whole big issue here that we can not only solve, cure for the rest of the patient's life, but literally like giving a new lease to life. So that's why the title, that this is not just a face-changing procedure where a lot of movements are done, but basically to improve the function of speech, which is a multifactorial issue with the septum, with the jaw, with the breathing, with the position of the uvula, pharyngeal wall, so on and so forth, and hence needs a few investigations, hence needs much more thorough evaluation and planning before we can cure these patients. We have cured several patients in the last decade plus years here. We do about 15 to 18 every year consistently in the last few years. So there are a lot of patients who can get these kind of problems solved. Do let us know what your concerns are. We're more than happy to give you guidance. You can consult us. You can ask your queries, and we'll be more than happy to help you and take you further in order to live a new life, a life where sleep is so important, and that can be restored in case it's not perfect already. Thank you.